Dr. William Osler, the famous physician, stated, "A good physician treats the disease. A great physician treats the patient who has the disease." At a time when artificial intelligence and remote medicine is making treatment more precise, yet impersonal, there's a parallel movement that looks into the individual, the patient being treated, both for their body and their mind. Likewise, new research under compassionate genetics emphasizes the need for empathy, communication, and understanding for the success of treatment and for the well-being of the physician. So are we ready for patient-centered care, especially when it comes to our heart cardiology? Namaste, I am Nutan Manohar, adjunct faculty with the Indian Institute of Management, Kozhikode, guest lecturer at JIPMA, founder of Me Met Me, and on behalf of Times of India, I welcome each one of you to TOI World Heart Day Symposium 2023. Every beat counts. Patient-centered care in the realm of cardiology prioritizes the individual's well-being and preferences. It entails a collaborative approach where healthcare providers engage patients in shared decision-making, taking into account their values and goals. This approach goes beyond just treating cardiovascular conditions. It focuses on holistic care, emphasizing on lifestyle changes, emotional support, education, and awareness. By tailoring treatment plans to each individual patient's unique needs and involving them in the process, cardiology can achieve better outcomes and foster a sense of empowerment, ultimately improving the overall quality of care. This session of Times of India World Health Day Symposium 2023 is dedicated to exploring the concept of patient-centric care in the arena of cardiology, a topic of profound importance in our quest for heart health. We have a distinguished panel of experts with us, each a stalwart in the field of cardiology. Please allow me to introduce them to you. We have Dr. Rishi Sethi, Professor, Department of Cardiology, King George Medical University, Lucknow. We have with us Dr. Prashant Jagtap, Senior Interventional Cardiologist, Viveka Hospitals in Nagpur, Maharashtra. We also have with us Dr. Santosh Dora, Senior Cardiologist and Cardiac Electrophysiologist, Asian Heart Institute, Mumbai. We are also expecting Dr. Kartikeya Bhargava, Cardiologist, Medanta, the MedCity in Gurugram. The very first question is to Dr. Rishi Sethi. What is patient-centered care? How is it different from treatment a patient experienced in the past? And why do we need patient-centered care?
Thanks, Nutan, for the introduction, for inviting us. And I think my job has been done by you because you have very eloquently spoke about all the aspects that would be contained in this term that physicians now are getting used to, that is the patient-centric care. Till now, the focus has been on how the hospital management, how the treatment protocols, disease-wise, and what is the physician's. So it was predominantly disease and physician and the hospital-centric healthcare system that had developed. But now we realize that until we put the patient's need beyond his particular disease that we are focusing so much on are also taken into consideration, the outcomes that we want to achieve for our patients may not be very fruitful. In that context, the term itself is ironical, patient-centric treatment. Every treatment should be patient-centric. Why are we doing any treatment per se? And there comes a little conundrum of different terms that are used by the physicians and the healthcare systems. One can be personalizing the treatment according to, you can have a treatment that is based upon a generic disease. You can have a flowchart that if you have a blood pressure, do this. If you have a heart attack, do this. That can be universally applied to all the patients. But at the same point of time, if you tailor those protocols on the individual patient's need, that would be something that would become under the ambit of personalized medicine. And then if you go on a step further and do some genetic analysis and do some biochemistry and make that personalized medicine more scientific, then it comes under the realm of something that we call as a precision medicine. So all these are also part of like a patient-centric, more patient-focused approach. But holistically speaking, I think when the patient-centric approach of the treatment is used, it's essentially to taking into account the psychological, the social, the age, whether the patient is very old, the geriatric population, or a very young patient, if it's a male or a female. So gender issues, psychological issues, social-cultural issues, economical issues, all these things taking into consideration and trying to devise the best possible therapy that we can offer the patient. I think all these are softer points that are many a times mistaken, not taken too seriously by the physicians, and that is why we should be putting them in the focus. So the patient-centric approach should be looking at the patient as a whole, beyond the specific disease process that each of us are addressing, and trying to advise the right treatment for that patient.
Thank you, Dr. Rishi. I have a follow-up question here. So
yes.
When somebody is walking into the department of cardiology, already they are quite vulnerable and maybe even anxious. So how does patient-centered care in cardiology address such emotional and psychological needs of patients?
So in cardiology is a dreaded, kind of both a dreaded as well as very common problem for which people come to. It can be very simple problems in terms of handling hypertension, but many a times we encounter patients in ICUs. These are young individuals at the prime of their life, and they have suffered, let's say, a myocardial infarction, which is a heart attack in common term, and they have their family or their the social structure of what they were doing was absolutely unprepared for this accident. And when you meet them, you of course know what the patient has, and that based upon his risk profile, what is the treatment plan and how it should be offered, and what are the prognosis of this patient, But at the same point of time, the patient is having it for the first time. It's a routine for us, but it's a very, very important day or hour in their life. It's a very, very important landmark. So trying to understand what is the milieu of the patients, what are his stress figures. A young gentleman walking in his late 40s has young children that he's thinking of, So all these kinds of things, most of them are young families in terms of acute coronary syndrome. So trying to explain your treatment prognosis and the further treatment plans, keeping into consideration his educational, his social, his cultural, emotional, psychological profile, and thereby we would be able to reach out to him and his family, or her and her family, in a more dignified way, in a way that is more acceptable to them, rather than just blanketly saying it as we'll say for every patient. So I think developing and maintaining a psychological intimacy with the patient and their relatives during the times of crisis is of utmost importance in all medical specialties, but I would say more so in cardiology, when the people come with absolutely unprepared for their acute coronary syndromes.
Thank you, Dr. Rishi. That was insightful. Dr. Prashant, just adding on to what Dr. Rishi was saying, see, in some cases, after a medical appointment, a patient might feel good, even if the news was bad. And sometimes, unfortunately, a medical appointment leaves them completely dissatisfied. Now, within patient-centric care in cardiology, how can you improve patient satisfaction and engagement?
I think this is a very important issue. I'll put it in other words. When you treat a disease, you win or you lose. But when you treat a person, I guarantee, irrespective of outcome, you win. That is the essence of person-centered or patient-centered care. Now, when a patient presents to you, it's very important, the communication between you, the eye contact, the way you talk to him. And it's very important to understand what cultural background he comes from, what are his values. There might be a patient who might be believing in some Ayurvedic treatment. So you have to respect that. Though you know that that may not be effective, still, let's say a patient comes to you with high blood pressure and you advise him some medications. He may not be willing to accept that. He will give you hundreds of reasons. He might give you some reasons that he is trying to lose weight, he is trying to cut down on salt, and he may not take the drug, and he will insist that I am trying Ayurvedic treatment. Well, while respecting his cultural values, at the same time you have to emphasize that hypertension is a silent killer. So it is very important to take medications. It is important to monitor blood pressure at home, so that he understands the importance of the disease. So in essence, communication between the patient, the confidence with which you tell the patient what disease he has, and the fact that the disease is treatable, can make wonders, and he might accept whatever you say. So one thing is communication. Second is being compassionate and empathetic with the patient situation. Just like Rishi just now told, a young patient comes to you with heart attack. He has so many questions. What about his personal life? What about his professional life in future? What are the financial implications of the disease? And if he has to undergo surgery, would it pain much? He will be, very anxious. So explaining all the treatment options, explaining everything, telling him about the risks and benefits, I think that goes a long way in treating a patient. So in essence, compassion, empathy, and communication. That is what is patient-centered care.
Thank you, Doctor. That was beautifully put. Thank you so much. At this point, Dr. Santosh, so now what challenges or barriers exist in implementing patient-centric care approaches in cardiology?
Yeah. Thank you for inviting me for this webinar. There are some main barriers that I will discuss. And in fact, Dr. Prashant also has explained some of these things. One of the cultural background, the educational background of the patient, and whether he is able to understand the way we are explaining them. Not only the patient's relative who are accompanying the patient. So we should probably explain in a way the patient understands. Maybe sometimes there may be language barriers, but I think in a hospital base we can definitely find an interpreter. Most of the time, if the patient is uneducated, the relatives are educated, so they communicate to the patient. So we have to explain considering the patient's, not only the relatives. I'll emphasize that patient also should understand about the problem. Then only we can expect, we can involve the patient in the decision making or in the disease process. So the patient also should understand the problems. There are the other barrier is the time that a doctor has. Suppose if a doctor has some 50 patients, how much time he can give to a patient? And if the patient has, has a complicated problem, you must give enough time for the patient to understand, the relatives to understand. It's not only putting a stethoscope and writing on some medicines, telling the patients that, okay, these are the medicines to come next time, this test. So that is not the way we should see. As previous speakers have already explained very well, we have to take the patient and relative into the confidence. So we must give enough time for the patient and the relatives to understand the disease process fully and to be part in the decision making. So time is another barrier. We'll have to find out. There is no other way. We have to give sufficient time to our patients. Access to care of the treatments is another problem. There are many barriers. The patient might be coming from a very far distance. How much time he can spend in a city? Suppose if I'm in a city and a proper care treatment can be given in a city hospital, then whether he can afford the cost of the treatment, stay problems, all those things are access to care. That is another thing which needs to be issued, and we'll have to find out how best that can be done. And the emotional care about the Dr. Prashant has very well explained. The empathy, the sympathy, the compassion that we need to show to the patient and the relatives, especially when there is a chronic patient, like a chronic heart failure. Patient's ejection fraction is 20-25%. He is often getting into heart failure, getting recurrent admissions. There are a lot of emotions are involved. So we'll have to have emotional support also to the patient. So the patient should feel like the doctor is a part of family. Then the problem is solved. Have to involve the family, the family and friends, so that the patient is not alone. There are other people to take care of that. They can take care of the day-to-day needs, giving the medications, giving the physical care, emotional care, everything that is required for the patient. And continuity of care between the healthcare settings. The patient is somewhere, I am somewhere, patient comes to me, I see the patients, but the continuity of the care has to remain. sometimes that breaks. If the patient changes the hospital or doctors or settings, then it may change. So we have to have a system of making sure that the patient continues the care. So should not stop some medicine, should not, without having any, if required, the doctors from different cities, they can talk to each other, make sure that the patient gets the confidence that the continuity of care is established or is there. So these are some of the things that I enumerated. There are the barriers, but can be definitely taken care of.
Thank you, Doctor. Thank you so much. Dr. Rishi, if I may, we see a very interesting situation here where in India, you have one profile of patients that are uneducated, and the other hand, you might have a highly educated patient, but with maybe low awareness when it comes to medical conditions or their own health, or maybe have wrong kind of information associated with their health. So in such situations, how can you really have shared decision making when it comes to patient-centered cardiological care?
So that's a very interesting question. But I think it's especially when we talk about shared decision making, it essentially means diseases that have got a little serious or a little criticality in terms of, as the previous speaker was saying about the chronic heart failure. But many a time the disease process in the acute phase, as I mentioned, acute admissions for heart failure, heart blocks, or any medical emergency, heart attacks, there the patient has so many questions. So there are 2-3 subdivisions we can make. I mean, if someone is absolutely ignorant and let's say coming from a very rural background, and you can just get away by explaining the risk, explaining the disease, and then try to put upon yourself that you would be taking the best possible decision. You can't be, and of course the economics need to be explained whenever they are involved. But beyond that, if you try to burden them with too much information, I think that would be a little counterproductive in terms of achieving what we are set to achieve. Coming to the second point of a medium or a highly educated person and their family, and they have so many questions. I think rather than being offended by the questions asked, we must try to handle them in a more academic way and trying to address whatever the queries are. And sometimes if the queries are very illogical, then we can gently put them down that these are not a concern. In that context, when the patients come to us, it's my personal experience that whenever someone who is educated, who is well informed, let's say has a heart attack and has to go a procedure in terms of angioplasties or bypass, they understand at the back of their mind that it's a risky situation. It's about that their mind is stressed because they know that there is a risk situation, risk as serious as losing their life. The point is the patient and the relatives want the best out of the given situation. In fact, they know the risk, but they don't want to be treated by someone who's compassionate, is not compassionate. They don't want to be treated by an hospital that is not fully equipped. So if you have skills, you have equipments, and you are compassionate, everything, you have to explain to the patient. And one trick works many a times, if by your communication you can explain to the patient and their relatives that there is a triangle. There is a disease process that carries a certain amount of risk. There is the physician in the hospital which can offer a certain amount of help in a scientific manner. And then there is the patient and their relatives. So patient and the relatives, doctors and hospitals should be on one side, and we all should be fighting a common enemy, which is the disease and the risk. Whenever the hospital and the doctors keep the disease, the patient and the relatives on one side, then they come on the opposite side of the line. So it's the patient and their disease on one end and the doctors on one end. That is the cause of all the tussle and all the confusions and all the complaints and suits that followed. If we are able to convince the patient and their family that disease and its risk of the disease is the common enemy, and we together, physicians, hospital, patient and the relatives, have to fight it and let the best and hope for the good outcome, then I think 90% of the job is done. Even if something unfortunate happens, the patient and the family know that they got the best shot at least.
Thank you, Doctor. I guess we are in it together is the message that they should feel. So thank you so much. That was beautifully put. So when it comes to patients trying to participate in their own, say, treatment, what resources or tools are available, and how do we actually ensure that patients can actively participate in their cardiac care?
I think there are two types of patients when we practice, particularly in Tier 2 city like Nagpur. We have, uneducated patients who are coming from the villages. Generally such patients have blind faith, and then whatever you convey. So as a physician, you carry a great responsibility. You have to give them the right treatment and at the right cost. That's very important. For those patients who come from the city and who are very educated, knowledgeable, they have, Googled everything and they know all the treatment options. In such patients, I think it's a little challenging to explain all the treatment options. In such cases, you have to explain the negative side of angioplasty, the negative side of bypass surgery in cardiac patients. In heart failure patients, it's important to tell them what is the prognosis, particularly the relatives. So it's depending upon the patient, you have to convince and change your language and convincing ability. So totally, as clinicians, we have to face this dilemma day in and day out. Some patients are very educated, intelligent, and you have to talk to them in a different way altogether than those patients who come from remote and far off places. They generally they give you, they tell you, doctor साहब आपको जो करना है वो करिए, हम आपके पास आए हैं. So that's very challenging situation, and unfortunately many of them have limited financial resources. But as physicians, and I'm sure every physician in India tries to manage the treatment in a contained cost, which is so different from the Western world. In the Western world, everything is so insured and there is no problem of the cost. But in India, we try to manage everything within the patient resources, and that's why, because the doctor is the same, and because we manage the financial scenario so well, Indian physicians are so great, across the world, because they totally work in a different scenario. I think Rishi will agree. He works in a government setup. He knows how difficult it is to manage patients in limited resources, particularly in India.
Thank you, Dr. Prashant. Now to Dr. Santosh Dora. I was thinking to myself, how would you assess and measure the effectiveness of patient-centered care initiatives? For instance, do you use surveys and questionnaires to understand how is it that they're responding to the patient-centered treatment? Do you conduct focus group discussions, or do you track reduction in complaints, which could include, say, legal suits, or what about, say, the increase in adherence to treatment, etc.? So what do you think are the ways someone can assess and measure the effectiveness of patient-centered care?
Yeah, I think in the corporate hospitals, and I agree, many different government hospitals also, the patient satisfaction is a very given so much of priority by the administration. So the feedback scoring system, feedback thing is available with the in the reception desk, and the patient, when they go back, they're routinely asked to give their feedback on different things, on the doctors, on the staff, the care they've received, the way the care was received, and the different things. So I think that is one of the basic thing that most of the hospitals they do to understand what is happening to the patient from the management perspective. So these scoring things goes to the management, and they analyze things, and of course they take proper actions, whatever needs to be done to improve patient satisfaction. That is one thing which is commonly adopted by many hospitals. And second thing is the impact of health, whether the patient is really improving whatever has been done to the patient, the treatment offered to the patients. So there are different, especially in the cardiology, we have some scoring systems like for heart failure, I can tell you about Kansas City cardiomyopathy heart failure scorings, where there are a lot of questions which the patient we are around 23 questions patients, depending on his day-to-day activities, like how well he is able to shower, how well he is able to eat, how well he is able to walk 1 block, how well he is able to dress himself, how well he is able to interact within the social gatherings. So all these things, point-wise, the patient can put a score, from 1 to 5 or whatever given to him. So that way, one can analyze before the treatment what was the score, and in the process of the treatment or after the treatment what is the score. And we can come to a conclusion whether the patient is really improving from day-to-day living standards, whether it is helping him. So that is one of the things. I don't know. I think, frankly speaking, we are still to adopt these things for our patients, heart failure patients, but we are in the process of that. But I think some of the hospitals might be doing that. And this is a very, very good proven system to understand how the patient is doing well or same or worse. Okay. And to understand, the other thing is the cost implications, whether the cost, at what cost the patient is getting the treatment, whether he has to pay. Patient health may be getting better, but they're losing a lot of finances if they don't have insurance backup. So these are the things also puts patient into a little dissatisfaction, because they might get better, but at the same time they might have, or we should see, assess for the patient assessment after giving the care to the patient.
Thank you, Dr.
Thank you.
Santosh.
Thank you very much.
Thank you so much. Dr. Rishi, I'm sure everybody agrees to this, that you are brilliant when it comes to clarity in communication. But I would love to know, what is your secret when it comes to effectively communicating complex cardiac information to patients? What is the advice that you might have to share with us? Doctor, you're on mute. Could you unmute?
Sorry. So, as I said earlier, I think the key is developing the kind of trust with the patient and family, and trying to convince them, not in a very pseudo way, but in a way which is very empathetic to them. That, you see, this is the problem. I'll give you an example. A young patient is in heart attack, and he walks inside the emergency department. You give him treatment, and then you say that he needs to undergo a certain procedure. Most commonly, an angioplasty is done. All the cardiologists, all the global healthcare system agree that even with the best possible care, the risk of mortality, means losing your life, is not only just complications, is anywhere between 2% to, let's say, 10% in various clinical scenarios. That means out of every patient of heart attack that's going to walk inside your emergency, you have a chance of losing 1 in 10 to 1 in 20, 25 patients. So something like that. So it's a pretty serious condition. But at the same point of time, if you tell them that this is the condition, if we do the procedure, then the risk narrows down. It doesn't become zero, but it narrows down. We will try to do and we are trying to offer, if you don't do, the risk is around 10%. If you do a procedure, the risk is cut down to 1 to 2%. We are giving you an 8% advantage, but no one can predict 100% advantage in any procedure, any disease. So that are the risks. What we can offer you is that we will do what is best available globally, internationally, to the best of our ability, and let's fight together this disease menace, the disease risk that has come on to you. So if you are able to translate it into this fact that the hospital and the healthcare doctors are empathetic, they understand the disease process, they are skillful in treating it, the hospital has every possible infrastructure that is required, then they willfully give their life in your hand, and you become and even puts down the stress on you, because when you are doing a procedure, if you have not communicated that, anything untowards happening puts a lot of pressure on you. But if the family and the relatives are also backing you, then you naturally become more responsible for them, and you tend to outperform yourself also to ensure that, to give the best possible outcome. So I think that we need to make the patients convinced that we have to work as a team, and it's an unfortunate condition that they have been put into. Let's fight it together, and let's try to get the best possible chance in the most cost-effective and ethical and scientific way.
And when you put it that way, we realize that what is good for the patient is also good for the doctor too. So thank you. Thank you so much, Dr. Rishi. Dr. Prashant, if I may, in what ways does patient-centered care impact long-term adherence to cardiac treatment plans? I'm pretty sure you have many patients who do not stick to the follow-up treatments, etc., or follow-up plans when it comes to medication. But when it comes to patient-centered care, does it have an impact on long-term adherence?
Yeah, because most of the heart patients require chronic therapy, meaning heart attack patients, those who have hypertension, high blood pressure, they require treatment for a long time. So it's very important for the clinician to explain to the patient what is the need and what is the importance of each and every drug. Likewise, a patient has gone an angioplasty, the blood thinners he has to continue throughout the life. Similarly, antihypertensive drugs he has to take throughout the life. Apart from the lifestyle modifications, of course, like weight reduction and salt reduction, all that. So what is important is how you go about it. It's very important when the patient is getting discharged, the treating nurse or the treating resident medical officer explains all the drugs to the patient. If he has any difficulties, you explain, and then you write down and you explain to him that these and these drugs are very, very important for you. You are not supposed to stop them unless you consult your treating physician. So that's one important. In terms of antihypertensive drugs, it's very important to tell them that you can, put an alarm in your mobile or something, use a blister pack, or as a clinician, you might give, a single pill, a combination pill, which would increase adherence to the drugs. Very important. Sometimes if the patient is elderly, then it's important to involve the relatives and explain to the relatives what is the importance of, if the medications and the timing of the medications also. And depending upon the patient's profile and his patient's lifestyle, you have to change the timing of the drugs as well. You can't write a drug at 7 o'clock if the patient is getting at 9 o'clock in the morning. So it is absolutely then it is not a personalized, it is not a patient-centered care. So a patient-centered care is when you understand the patient. That is what's very important. You understand his nature, you understand his behavior, you understand his ethical values, you understand what is his thinking level, what are the values he believes in. This is very important to understand, and then according to that you individualize the treatment to that particular patient. So very important. So doing an angioplasty is half the process done, but ensuring that the patient takes medications regularly, diligently, and comes for follow-up is another 50%, which is also equally important. There are so many patients, about I would say 10 to 20%, who would stop the medications after 1 or 2 years unless you have not explained to them what is the importance of that. And lastly, you had asked in the last question was, what are the resources? I think you should tell them about the various apps which are available on the net. You should give them handouts. And in my clinic, I usually keep the videos running about angioplasty, about various procedures, so that they are made aware when they are sitting in the reception waiting for their turn, so that they get to know about knowledge about the disease process, and they are they acknowledge the fact that they have understood the disease process well. And once you explain them properly, I think most of them would follow the treatment and would follow the treatment throughout their life. And that's very, very important. So adherence is very, very important in cardiology, at least in whether it is angina or bypass patients or whether they are hypertension patients. Very, very important.
Thank you, Doctor. I had a question on adherence. You have answered that beautifully. I wanted to have a follow-up question on patient values and preferences, but you have preempted me. You have answered that as well. So at this point, I would like to understand, have you noticed any changes when it comes to the healthcare center itself in their productivity and in terms of their profitability? Has it improved by being more patient-centric?
Absolutely. When you are patient-centric, and when the same patient is seen, attending the same doctor, it instills a lot of confidence in the patient. So your appointment system should be perfect. Your emergency system should be perfect, meaning they have to know in case of emergency whom to contact, where to come. And once they know all about it, they are assured. Then I'm sure they will continue to follow with the same doctor. And one of the nice trick is, and one of the nice ways is to ensure after the patient is discharged, 7 days after discharge, to ask him how he's doing. Is he having any problem with the medications? Because in the hospital, the nurses are taking care of the patient. Once he reaches home, all problems start cropping up. So very, very important to call the patient after 5 days or 7 days and ask him how is he doing. And the way you respond and the way you take care of the patient, I think that is very important in it is not only the treatment, but it is also the personalized care and the personalized treatment you give to the patient, which makes an impact on the society. So that is very important for the hospital.
Thank you, Dr. Prashant. I have a question to Dr. Rishi. Dr. Rishi, when it comes to cultural differences, what measures are in place to promote cultural competence and diversity in patient-centered cardiology care?
So I would say, unfortunately, presently the systems are not in place. But at the same point of time, we are getting more sensitive to both the age-related issues in terms of we can't be offering the same kind of advice to the extremes of ages. We are getting more sensitive to the sex-related issues in terms of gender-related issues, where we have to, many a times it is seen and it is very clearly documented in cardiology literature that women are treated in a worse way in terms of both receiving the care that they are supposed to reach, and because they don't get the care that is offered to their male counterparts of the similar diseases, the outcomes are poor. So we have to understand that. And of course, then there are cultural issues based upon, religion and cultural and regional variations. I think just being sensitive to all these issues in terms of communications, I don't see that outcome, whatever we offer as a scientific medical treatment to different age groups, apart from the age, will differ. I mean, you will essentially offer the same kind of scientific treatment that you will be offering across geographical areas, let's say in a country like India. Of course, there are some regional differences which are different between the Caucasians and Indians and the African populations. But then speaking for a country like that, you will essentially offer the same kind of treatment, but the way you are offering it, the cost you are offering it at which, and trying to understand the ethos in terms of the gender, in terms of the age, in terms of the socio-cultural, regional backgrounds, that has some effect. Age, on the other hand, is something that we have to be really, really careful, because at the extremes of age, especially the geriatric population, we have to be very, very sensitive about what kind of medicines, because these are the people who are hypersensitive to the toxicities of medicine. If we give them the same kind of antiplatelet agents, they may have cerebral bleeds. If we give them very strong antihypertensive drugs, they may have a sudden fall in blood pressure. They may fall down and fracture their limbs. So all these things are very, very important in terms of communication. For example, I'll just give you one example. If an elderly patient with a heart attack, comes to us, when the patient is going back, we would just advise him that, get the bolts of his toilets removed from inside, or ask him never to lock the toilets whenever he's using the washrooms or bathrooms, because many a times such people may have a fall, they may not call for help. So all these things need to be built in the system. And essentially, for medical treatment, scientific, I think mostly it's the same, except for the extremes of ages. But then how you communicate and how you deliver makes a difference.
Thank you so much, Dr. Rishi. At this point, Dr. Santosh, I have two questions for you. So very briefly, if you could help us understand what research and innovations are currently advancing in patient-centered care.
Research is basically, suppose now I will just give some examples so that it will be more easy to understand for the patient perspective. Suppose in case of arrhythmia, we are treating some arrhythmia, that means heart rate disorders, low heart rate or fast heart rate, for the patient who has palpitation or giddiness, those kind of things. There are many possibilities. Suppose if I want to know what kind of things that he is having, now you can know the smart watches like Apple Watch has come up with the facilities of recording the heart rate, or many different other smartwatches also have the facility to detect saturation, the heart rate, the respiratory rate. There are many parameters that catch up. So these are the innovations which have happened from the company perspective, which help in the medical ground also, and patients with certain medical conditions, which picks up the heart rate and tells. There is a recording facility also. Patient can record that and send that record to the doctor. So we can find out whether the patient is having arrhythmia. Sometimes we can't catch the arrhythmia because if it is just for a second or for a few seconds, then by the time the patient comes to the hospital and we get a ECG done, the ECG will show a normal rhythm. But then we'll say the patient, everything is normal. But the patient said that half an hour back, I had some palpitation. But we missed that because we could not record that. So here, in these cases, these smartwatches, they help picking up those rhythm problems at the same time immediately and send the records to the doctor so the doctor can understand. So these are the things which there are other recording devices also which can be put even for 2 weeks, 3 weeks, 1 month, or even for years to catch up these arrhythmias. So these are the things which advanced technologies which helps us in capturing some of the problems which help in the long-term treatment of the patient to offer the right kind of treatment to the patient.
Thank you, Dr. Santosh. That was wonderful. Before we conclude, I would request Dr. Prashant. Dr. Prashant, if you could help us understand what is the role of family members or caregivers when it comes to patient support in a patient-centered care. Doctor, could you unmute yourself, please?
Family members play a very crucial role, particularly when young patients and very elderly patients. Young patients, when a young patient gets a heart attack, the family is all totally disturbed and goes into disarray. And very elderly patients, because caregiving is so difficult now, most of their daughters or son may not be in India, they might be abroad. So in such circumstances, the other family members play a very crucial role. Now this crucial role not only is important for emotional support of the patient, but it also in important delivery of healthcare. Like once they reach home, giving medications and all that's very, very important. Not only the treatment part, but giving the emotional. Nowadays, it is said that whenever you give a personalized medical care to a patient, there should not be strict visiting hours. When a patient is in the hospital, he should feel that he is at home. He should be surrounded by his few close relatives who would give him emotional support, psychological support, and give him confidence. That is very, very important. And if you can give an impression that your hospital is nothing but his second home, that's it. That is what is, I think, personal care or person-based treatment or patient-centric treatment. That's very, very important. So the theme of this World Heart Day is, know your heart, use heart and know heart. I would go further and tell the physician that speak from your heart, talk to your patients from your heart, from the bottom of your heart. That would go a long way in treating the patients.
And I guess patients can take heart.
Yeah.
Thank you so much. I would like to express a sincere gratitude to each one of you for sharing your time and your insights when it comes to patient-centered care. So Dr. Rishi Sethi, thank you so much for your time and your insights. Dr. Prashant Jagtap, And Dr. Santosh K. Dora, thank you so much. It's been a pleasure having you here with us. And we look forward to having further discussions with you in the future. Your insights have been invaluable in shedding light on the future of patient-centered care in cardiology. And thank you all for being part of TOI World Heart Day Symposium 2023. Every beat counts. Your presence and contribution have made the symposium a resounding success. Thank you so much.